Hi, Dr. Berglund here. I just gave you something that was for a cream that's for hormones, all right? And so I'm just going to try and explain to you like how to put that on, right? Because there's a specific weight for each one, and I just want to make sure that you get the maximum benefit out of it. I don't want you putting it on wrong, okay? So, first things first, the most common one I'm going to recommend is progesterone. Now, progesterone for me comes in a cream or an oil, okay? The oil isn't an oil, it's kind of a creamy oil, but it's still an oil. So it's gonna come out in drops. This is gonna be like a cream or a lotion, okay? So I gave you progesterone. If you are still menstruating, right? If you're pre-menopause, right, and you're still having periods, then what we're gonna do is with this is we're going to apply this usually 1 or 2 times a day, okay? And you're going to apply the however many drops, however much cream I told you to take. We're going to apply it to thin-skinned areas. Now, thin-skinned areas for everyone, all right? It's not anywhere between, not between here and the tops of the knees. Where I can feel the skin and bone, that's just skin and bone. Where I can see veins, that's just thin-skinned areas. So backs of the hands, right, is very thin-skinned, okay? So I tell people like, okay, if I'm using the oil, I'm gonna go 8 drops, 1, 2, 3, 4, 5, 6, 7, 8, and then maybe just start smearing it in, okay? And so backs of the hands, backs of the arms here tend to be fattier. So we're gonna go inside, so back of the hand, inside part of the arm, inside part of the upper arm, right? And usually for people that have normal, let's call it skin thirstiness, right, for oil, right? That's going to be, there's going to be between 2 arms, that's plenty of skin surface to absorb in all the oil. What I don't want you to be is all greasy and oily afterwards, right? Because then your clothes and your sheets are going to have oil on them, and your sheets don't need progesterone. They don't need that. You need it. So I want it to be kind of absorbed in. Now, if you have skin that's super, like you can put lotion on 8 times a day, you're that kind of person, then you're going to put this on and go, it's absorbed already, right? Half an arm, it's already absorbed. And you go, can I put lotion over the top of it because I still need more lotion? The answer is yes, you can. So that is not a problem. But I'd rather have you put this first and the lotion second, if that makes any sense to you, okay? So the drops are similar to the cream, except that the cream is harder to quantify. So with the cream, I'm usually going to recommend 1/4 or 1/2 teaspoon. So I really want you to go to the kitchen and get yourself 1/4 teaspoon or 1/2 teaspoon, okay? And you're going to scoop in the little jar, and then you're going to level it, right? And then you're going to have 1/4 teaspoon of cream. And then you're just going to take that out and then apply that, okay? Do that at least for humor me. Do that at least for the first 3, 4, 5 days, at least, till you start going. After you scoop it out of the teaspoon, you get an idea of like this little lump of cream on you going, I think I know what that is. I don't need you to measure this on a scale. We don't have to get that exact. I just want to make sure that you're not guessing, and then you don't, from day to day you're all over the map. Then I don't know what you're taking. Then if I ever have to increase it or decrease it, we don't really know where you are. Okay? So that's the cream. So that's progesterone. Now, the other tricky part about progesterone is if you're menstruating still, okay, then you're going to skip the first 7 days of your period. Now, day 1 of your period is the first day of your period, okay? All right? And you're going to go 7 days and not taking it all, okay? And then on day 8, you're going to start taking it through day 28, assuming a 28-day cycle for you, okay? If you're 29, you know you're 29, or 27, you know you're 27. Sure, you can just adjust it accordingly right away. Okay. If you say, well, I'm normally 32, I'm like, no, you're not. Or I'm not 32, like 42. I'm like, no, you're not. You're not 42. Okay. I'll allow you even to be 30, that kind of stuff, but I'm not going to allow you to be 42 because there's no way you're normal at that. Okay. So we're going to go day 8. You're going to be taking the cream or the oil from day 8 through 28. Okay. Then day 1 becomes your period again. Now you may go, I'm not that regular, okay? That's fine, but then if day 25 hits and you get a period, right? That becomes day 1, okay? Day 1 is now again, the first day of your period, right? So every time that you have something, every time you have a significant, I'm not talking spotting, but you start your period. You guys know what that's like. I don't know. You guys know what that's like, right? So then that comes day 1, and you always count that. So if you go day 1 through day 7 and you're off, and you start day 8 and you go all the way through day 28 and you're still going, and then you go day 29, you stop taking again because that's now day 1, right? And you go through 5 days, and now you get your period. You're like, well, I've been off it. Yeah, no, day 1. Day 5 now becomes day 1. And day 1, now you're back to here. Yeah, but then I'm going to be off this for like 12 days and not 7 days. I know. Yeah, but that's what I want. We're trying to work with your system where it is and trying to help it get more normal, right? And the challenge for us with progesterone is, if we're trying to help things move along, help you with fertility, help you get less painful periods, less bleeding and all this other stuff, that it's going to take 2-3 months to really get this, if we're at the right dose, to kick in. So I just want to let you know that that's what we're doing, okay? The other ones that we do, so there is another one that I use that's called biased, okay? Biased is basically the same exact thing as progesterone. I want it applied the same way as progesterone, except it's 2 different forms of estrogen in here, okay? These are all bioidentical, by the way, all right? If we're doing some of these and you're perimenopausal, you're not having a period, you're perimenopausal or you're postmenopausal, then you can just do this all day long, all right? You can do, all month long. You don't have to take days off, all right? The other ones that we're doing are all, there's a testosterone one, and these are easy because the only reason I bring these out is they are thin-skinned areas as well. So I just want them thin-skinned areas, and that's fine. After that, we don't have to take days off, we don't have to do anything. So if you're taking stuff that's adrenal stim to bring up the adrenals, take a thing that's trying to get the cortisol out of the system, or trying to boost testosterone, this is how we do it, and we do it in thin-skinned areas. Anywhere it's skin and bone, that's where we do it. Now, if you run out of areas up here and you're going, I don't know, I still need to do this, you can do kneecaps, shins, tops of feet, all of those work. All right? So, and if you have any more questions, please contact the office and let us know. If you're having skin reactions, stop, please. And this should help. So I don't need to hurt you to help you, so hopefully this is all helping you, and then I'll see you next time, and we'll gauge, do you need more, do you need less, and I wish you well. Thank you.